So the next topic that we are going to discuss about your primary healthcare are the strategies and principles that is involved in your primary healthcare implementation. Okay, number one under these strategies is your reorientation and reorganization of the national healthcare system. This was done when the Devolution Code or the Local Government Code of 1991, which is your 7160, Republic Act 7160, was implemented, okay, in 1991. So this is basically separating now the national and the local government health. Okay, the local government. So in terms of the healthcare system of the local government unit, they are already given the responsibility and accountability to decide what is best and applicable to the current health situations they have. Okay? So saka lang po makikialam ang national government kung kailangan na po nila ng support coming from the national government, which is headed by the DOH or the Department of Health through the regional offices. So pag sinausapan natin ng national government, this is from the DOH to your regional offices, and provincial government is provincial health offices down to your barangay health stations. Okay, so they have to reorient. Okay, they have to reorganize that healthcare system na existing during that time. Okay, another one is that effective preparation. So effective preparation and enabling process for the health action of at all levels. So basically, the effective preparation comes with logistics and statistics. Okay, statistics coming from the local government. So this will be analyzed now in order to come up with the yung tinatawag nating plan of action that would address the problem that was identified during the with the statistical data that was collected. So we are going to make a separate discussion about the vital statistics concerning now health concerns in the community, siguro po within this week. Okay, another one is your mobilization of the people. So the mobilization of the people, this is in relation to the vision and mission of the primary healthcare, which is making the people independent towards their health. Because how are we going to do that? We make or we let the people do the action. Okay, that's why whenever we talk about health problems in the community, who should identify? It should be the family, it should be the people, it should be the community. It is not the nurse, it is not the professionals who are immersing or who are going to the community. Okay, so problema nila yon, kailangan sila ang mag-identify kung ano yung problema nila. They should be the one who will analyze that, and they should be the one who's going to identify those problems. And after identifying those problems, we let them think of solutions as well. Okay, we let them think of solutions and we let them do those solutions once approved na po noong buong community. Okay, so ano ang ginagawa natin bilang mga health worker in the community? We are just there to support them. We are facilitating them that in terms they need some technical assistance, okay, of things that they don't understand, doon po tayo papasok. We provide yung pinaka-responsibility natin or the primary responsibility of a community health nurse, which is to provide health education. Okay, so mobilization of the people to know their communities and identifying their basic health needs with the end view of providing appropriate solutions. So it's gonna be them. Sila ang bida, okay, and they will lead. Okay, they will lead whatever programs, okay, that is created, okay, and once it is done, it will now lead to a self-reliant and self-determined community. So yung tinatawag natin kaninang primary goal, which is enhancing the capability of the people. So the end product of that is self-reliance. The people will become independent from the government in terms of their health. Okay, another one is the development and utilization of appropriate technology. When I talk about appropriate technology in the community, we make use of the available resources. So to talk about the available resources of the community, we have your 4 M's. We have your first M, manpower. Second is your money. We have your materials and your machinery. So these are the 4 indigenous resources available in the community. And when we talk about indigenous resources and appropriate technology, we are just not referring to any type of equipment. We are not referring to any technological advancement. So when we talk about development and utilization of appropriate technology, it is referring to the community utilizing whatever resources is available in the community. The very good example of this is your halamang gamot. Okay, the DOH herbal medicine recommended. Okay, the recommended herbal medicine by the DOH. Okay, what else? So that is a system. Okay, the available structures that they have, yung mga organizations na meron sa community, we can also make use of that. Those are appropriate technologies in the community. Okay, aside from that, we also need to organize. Okay, organize communities. So magkakaroon tayo ng tinatawag na community health organization. So that this is arising from their expressed needs, which they have decided to address, that this is continually evolving in pursuit of their own development. So as time goes by, the system will work. If the system will work, okay, the community has to manage that system, okay, on their own. And in order for that to be possible, okay, we have to organize the community, and we have to organize them as a group, not as individual, because we want them to work together towards one goal, which is to develop their community. Okay, aside from that is increase opportunities for community participation, which in relation pa rin doon sa mobilization of the people. We want the people to become attached. Okay, we want the people to become involved in every action, in every activity that we want to develop their community. Okay, dapat hindi nila nilalayo yung sarili nila. Dapat lagi silang nakikisaw-saw. Okay, dapat sila ay pag may mga meetings, they have to be there. Pag may community assembly, they have to be there. Okay, because they will be part of the decision making. Majority of the decisions or all decisions in the community should be done by the community as a whole. Okay, if I am the nurse who are immersing in the community, I will not be there to dictate. Okay, to dictate kung anong gagawin nila. Okay, I am going to explain whatever technical matters they don't know, and it's still up to the community to decide whether that is a problem and this is the solution that we need to do, and they should be the one to act as well. Okay, to act as well. Okay, so another one is development of intrasectoral linkages. So intrasectoral linkages is within the community, okay, and with other governments and private agencies. So that programs of the health sector is closely linked with those of the socio-economic sectors at the national, intermediate, and community level. Like for example, the program that was developed by the community in relation to improving their healthcare system is to get funds from agriculture. So we can link them to agriculture department for free seeds, fertilizers, and everything that they can use, okay, or the department can provide to help the community grow with regards to their project. Kung kailangan nila ng mga social welfare activities, we will connect with the DSWD, and so on and so forth. So yun yung inter and intrasectoral linkages. Emphasizing partnership. Okay, we have to tell the community that we are partners. We are not the boss. Okay, actually, ang boss is sila because they will make majority of the decisions. Okay, we are there to facilitate the program. We are there to provide assistance if they need it. Okay, but at the end, okay, they need to know that we are all in this together, but in the end, once they already achieve yung tinatawag nating self-reliance, we are going to leave them. Okay, and they have to work on their own in order for the system that they have created to work. Okay, so we are just there to provide assistance, but we are considered partner. So it's a partnership between the government, the healthcare system, the health workers, and the community people. Okay, so those are the concepts about your strategies that primary healthcare is using. Okay, another important topic or important matter about your healthcare system, okay, or primary healthcare is the primary healthcare worker. Okay, so primary healthcare worker are basically the people who will help in the implementation of healthcare activities in the community as part of the primary healthcare system. Okay, so various categories of health workers make up the primary healthcare and team. So the types vary in different communities depending on the need, okay, with the following factors. So the availability of health manpower resources, okay, depende po yan. So sa isang community, maaring puro midwife, puro nurse, okay, depende po kung anong kakayahan ng community or local government unit na i-hire. Okay, and the availability of manpower na meron. Next is local health needs and problems. Of course, Kapag mas marami ng population ng community, dapat mas marami na pong healthcare worker na mag-handle sa kanila. And of course, according to the health problems. Like for example, the ongoing pandemic right now dictates that the healthcare system should add more healthcare workers to become part of the front line. Okay? Kasi nga, mas lumalala yung sitwasyon. And there is a clear need to add healthcare workers. And of course, another factor with regards to the addition or to the addition of healthcare workers in the community is the political and financial feasibility. Okay, we cannot remove the fact that it is a job, and a job requires salary. Okay, and a salary requires financing. Okay, and of course sa ating sistema ngayon na demokrasya, kailangan talaga in every implementations na gagawin natin, kailangan may saligan po siyang batas. Okay, meron siyang pagmumulan or the legal basis, which are the laws na ipine-present sa atin or na ginagawa. Okay, so the political and financial feasibility, like for example, the nursing act of the nursing act of 2002, which is your RA 9173. Okay, RA 9173. So nakasaad doon kung ilang healthcare worker at kung magkano dapat ang sahurin ng healthcare workers. Sabi nila is naipatupad naman na po yung salary grade 15 for healthcare workers in the public healthcare system, but I'm not quite sure with that kasi hindi ko naman siya talaga nakikita pa or na-experience. I haven't asked, but I heard na naipatupad na daw. Okay, so for those who are working in the government, okay, kindly comment it down po sa ating comment section para naman po ma-inform at maging aware kami na, uy, ganito na pala, salary grade 15 na pala na ipatupad na. Okay, and these are the levels of primary healthcare worker in the Philippines under your primary healthcare. Okay, we have two. We have your auxiliary workers. Auxiliary workers, these includes your volunteers, such as your barangay health workers or BHWs. Okay, so auxiliary workers are non-professionals, okay, or providing professionals, but they will be working as part or adjunct doon sa healthcare system na existing, okay, in coordination with the professionals working in the RHU. Okay, so the picture that I'll be showing you guys are the pictures of my former colleagues, sabi ko kong colleagues kasi some of them are nurses and some of them are midwives by profession, but working as a BHW when I was still working as a community health nurse. Ayan po. So shout out po sa City Camp Health Center kung saan ako nagtrabaho noon bilang isang community health nurse, sa mga nurses, doctors and sa mga nurses and midwives, plus mga BHWs and BNS na nakasama ko. And of course, with the doctor, headed by Dr. Nelson Hora. Yan, napakabait na doktor. So, kasama ko po dyan noon. Okay, of course, makasama ko rin sa HRDP, okay, which is the health resource program of the Department of Health, kung saan ako belong before when I was working as a community health nurse. So these are happy faces of real heroes. Okay, hanggang ngayon po during the pandemics, these are heroes. Okay, na mga tao na nasa lower level. Okay, and of course, aside from auxiliary workers, we also have the intermediate workers. So intermediate level workers, these are the registered professionals such as your nurses, midwife, doctors, pharmacies, medical technologies who are working at the primary level of healthcare facility. Okay, and of course, siyempre bidang-bida rin naman si Sir dito, kailangan kasali ako dun sa action. Ayan, so that is me when I was working as a community health nurse. That was August 2018. Nung bumabagyo po yan and kailangan naming magbakuna, okay, with regards to measles and oral polio vaccine. Okay, booster shots. So that is me when I was working in the community. Okay, so yes, nag-work ako sa community for 1 year, and it's a dream job for me before, but unfortunately kasi yung regularization is hindi ang hirap kunin, okay, because of the system that we have right now, because we are just working as contractual. Okay, so marami pa rin akong contractual nurses or friends that are still working with DOH, okay, but they choose to stay. Ayun, frontliners sila ngayon, sila yung mga umaharap. Okay, so yeah, so hopefully you will also consider going to community. May mga trabaho naman po tayo talaga sa community. The thing is, in terms of stability talaga, okay, yung tinatawag nating tenure, Okay, yung talagang pangmatagalan na trabaho. So I am not recommending it kasi nga nakadepende siya kung ilan yung budget talaga na iaalat ng ating gobyerno. So those are the two levels of healthcare facility. Two levels of primary healthcare worker. We have your auxiliary and your intermediate level health worker. So, okay, after now the discussion about the levels of primary healthcare worker, the next topic that we're going to discuss about your primary healthcare is the level of your referral healthcare system or your referral system. Okay, the level of healthcare and health referral system. So, your healthcare referral system, these are the facilities. Okay, the healthcare facilities that we have in the Philippine healthcare system, wherein each levels describes or has a certain population na pwede lang nilang i-cater. Okay? And has a certain conditions lang na pwede nilang i-cater. Okay? So whatever conditions that is not or cannot be catered doon sa lowest healthcare system or referral system, kailangan natin i-refer either sa susunod na level or to the higher level, okay, depende sa case ng pasyente. Okay, so like for example, so primary healthcare, so we have 3 levels, by the way. We have your primary, secondary, and tertiary. So for the primary healthcare system, this includes the lowest healthcare facilities, includes your barangay health stations, your rural health unit, community hospitals and health centers, private practitioners, and your puericultures. So puericultures are your lying-ins or bahay paanakan. So these are the lowest level of healthcare facility and these are your primary level. So these are the initial entry. So community setting po ito. Kung pinag-uusapan natin ng community setting, so this is around or at the level of your primary and secondary level of prevention. So initial part. So here, the basic healthcare services are available such as your family planning programs, your check-up, okay, your clinic visitations, your basic diagnostic tests available sa ating primary healthcare level. And of course, basic check-ups, check-up ng buntis, okay, the implementation of programs such as your national tuberculosis programs, family planning programs, maternal and child healthcare programs are all available in your primary level. And of course, some cases like your pag-aanak, okay, or yung delivery, okay, delivery which can be done in either rural health unit that has lying-in, okay, or sa ating mga puericultures or lying-in centers. Pwede din mga private practitioners for as long as they have the available facility, okay, and they are considered as primary level. So for cases that cannot be handled under your primary level healthcare facility, okay, they will be referred into higher level. So this can be to, okay, this can be to facilities like emergency or district hospitals, your provincial and city health services, or provincial and city hospitals. Okay, so for example, kung kailangan ng mag-CS or cesarean section instead of normal spontaneous delivery, pwede natin silang i-refer dito sa next level, which is secondary level healthcare facility. But if the case becomes more complicated and the case is it's no longer advised to be done in a secondary level healthcare facility, then we have to refer them to a bigger facility, which are now the primary or the tertiary level of healthcare facilities, such as your regional health services, regional health centers and training hospitals, the national health services or medical centers, teaching and training hospitals. Okay, so dito na yung mga yon. So kung mag-example po tayo dito sa Baguio City, okay, Baguio City, ang Baguio City po, meron tayong mga primary healthcare centers. Okay, primary healthcare centers natin are the city centers. Like for example, City Camp Health Centers and the Alonso District Health Centers. Okay? Tapos, pag hindi na kaya, we will refer them to a higher level of healthcare facility. Okay, for example, meron tayo noong Provincial Health Office, which is Benguet General Hospital. But if the case is not available, cannot be handled in that, okay, refer natin sila sa regional hospitals, which is your Baguio General Hospital. So those are your tertiary level of healthcare facility. Sir, kapag ba nasa primary level and in the primary level na-assess na hindi po kaya yung situation doon, kailangan po ba i-refer muna sa secondary level? Not necessarily. Okay? So if the condition, okay, at yung level of healthcare facility na pagre-referan mo doesn't have the proper equipment to handle the situation, for example, stroke, may pumunta doon sa primary healthcare facility, nagpa-check up sila or nagpunta sila doon during the emergency situation, and the person presented a stroke manifestation, yung tinatawag natin yung FAST, meron siyang facial drip, meron siyang arm drip, and meron siyang slurred speech, okay, which is common sa mga pasyente na may stroke. Okay? Alam natin na kailangan po siyang ma-CT scan to determine the type of treatment na pwede sa kanya, kasi kailangan natin malaman kung what type of stroke ang meron siya. So, kung ang secondary health level facility doesn't have CT scan, then we can immediately refer them to the tertiary facility. As a matter of fact, sabi dun sa ating stroke, i-refer natin siya sa pinakamalapit na healthcare facility na may stroke care capability. Okay, so pag sinabing stroke care capability, kailangan po talaga may available na CT scan. Okay, so those are your levels of healthcare and health referral system. For if you have questions, you can just comment it down po sa ating comment sections, or if you have some topics that you want to suggest na gawin natin ng video, okay, the video discussions like this, so please comment it down and we will find time para makapaggawa tayo ng videos to discuss those topics. Okay? And another important topic about your primary healthcare are the cornerstones or the pillars in primary healthcare. How does the primary healthcare works? Okay, so meron siyang four cornerstones, okay, or the pillars. So these are the four pillars of primary healthcare. Number one is your active participation. Okay, active participation, noting now yung mobilization kanina. Okay, that the people should be involved and they should be the one who is doing most of the activities, most of the jobs in the community, so that their capability will be enhanced. Then later on, ma-achieve yung primary goal natin, which is self-reliance. So see who will identify the problem? It has to be them. Who should identify the solution to the problem? It has to be them. And who will put things into action? It has to be majority done by them. Okay, active community participation. We have your intra and intersectoral linkages. We are able to discuss it sa earlier videos natin, wherein intersectoral linkages is yung referral natin sa mga other agencies like DSWD, Department of Agriculture, wherein the program is most related. Okay, we have your use of appropriate technology. Sabi ko nga kanina, the use of appropriate technology is not necessarily the use of proper equipment. So the use of appropriate technology is the use of whatever indigenous resources available in the community that can address yung situation or yung healthcare or health concern ng ating clientele. Then the last one is support mechanism made available. So for us to understand this better, okay, so active participation, we have be aware. Okay, be aware, and they have to identify their own problems. Okay, mobilization of social forces, the leaders and organizations, resources for health development, success is in the people themselves. Sabi nga natin kanina, the mission and the vision goal that the health of the people would be in their hands after the implementation of primary health care. They should become self-reliant individuals in terms of their care. For intersectoral linkages, okay, intra are the level of healthcare facility referral system. So either primary, secondary, and tertiary. So intersectoral is the referral to other agencies such as your education, agriculture, social, public works, non-government, and other local government units. Okay, so yun yung referral natin system. So ibig sabihin, inter is aside from the health sector. So who can help us? And the use of appropriate technology, this appropriate technology should pass the following criteria. Criteria includes the effectiveness of this technology, okay, the complexity cost, the complexity, the cost, the scope of technology, acceptability of the people, and of course, the feasibility of these recommended appropriate technology. For example nga po is the halamang gamot. So it's already proven na nakakapaggamot ng mga certain diseases, and of course it is affordable because sometimes it's free of charge. Nandun lang siya sa mga bakuran natin. Okay, and the last one but not the least, among the pillars is the support mechanism. This is the use of support equipment and facilities. Of course, every healthcare system requires equipment that would last for long, so that it can cater a lot of patients. And part of the support from the government is to provide this equipment necessary to provide a proper and just healthcare for everyone. Okay, so that is the discussion for primary healthcare. Again, if you have any question, just kindly please comment it down sa ating comment section. Okay, and if you do have suggestions about topics po, kindly comment it down sa ating comment section din. Okay, do not forget to click like, share, and subscribe, plus hit the notification bell din po para po updated kayo sa mga next videos natin. Okay, until next time guys, I hope that you have learned something from me about the primary healthcare system, and I'm gonna see you on my next videos. Bye for now.